Caffeine. Effect. Side effect. Caffeine. Hello friends, hope you enjoy the video on my channel. Today we will discuss the caffeine. Caffeine is a chemical found in coffee, tea, cola, guarana, mate, and other products. Caffeine is most commonly used to improve mental alertness, but it has many other uses. Caffeine is used by mouth or rectally in combination with painkillers, such as aspirin and acetaminophen, and a chemical called ergotamine for treating migraine headaches. It is also used with painkillers for simple headaches and preventing and treating headaches after epidural anesthesia. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one healthcare. Please also like, share and leave a comment below. How does it work? Caffeine works by stimulating the central nervous system, CNS, heart, muscles, and the centers that control blood pressure. Caffeine can raise blood pressure, but might not have this effect on people who use it all the time. Caffeine can also act like a water pill that increases urine flow. But again, it may not have this effect on people who use caffeine regularly. Also, drinking caffeine during moderate exercise is not likely to cause dehydration. Caffeine effective for migraine headache. Taking caffeine by mouth together with painkillers such as aspirin and acetaminophen are effective for treating migraines. Caffeine is an FDA-approved product for use with painkillers for treating migraine headaches. Headache following surgery. Using caffeine by mouth or intravenously, by 4, is effective for preventing headaches following surgery. Caffeine is an FDA-approved product for this use in people who regularly consume products that contain caffeine. Tension headache. Taking caffeine by mouth in combination with painkillers is effective for treating tension headaches. Caffeine likely effective for mental alertness. Research suggests that drinking caffeinated beverages throughout the day keeps the mind alert. Combining caffeine with glucose as an energy drink seems to improve mental performance better than either caffeine or glucose alone. Caffeine possibly effective for asthma, athletic performance, diabetes, gallbladder disease, hepatitis C, low blood pressure after eating, memory, breathing problems in infants, pain, Parkinson's disease, headache after epidural anesthesia, weight loss. Caffeine possibly ineffective for attention deficit hyperactivity disorder, ADHD. Most research suggests that caffeine does not reduce ADHD symptoms in children. The use of caffeine in adolescents and adults with ADHD has not been studied. Caffeine side effects and safety. Caffeine is likely safe for most adults when used appropriately. Caffeine is possibly unsafe when taken by mouth for a long time or in fairly high doses. Caffeine can cause insomnia, nervousness and restlessness, stomach irritation, nausea and vomiting, increased heart rate and respiration, and other side effects. Caffeine can make sleep disorders in patients with acquired immunodeficiency syndrome, AIDS, worse. Larger doses might cause headache, anxiety, agitation, chest pain, and ringing in the ears. Caffeine is likely unsafe when taken by mouth in very high doses as it can cause irregular heartbeats and even death. Products with very concentrated or pure caffeine have a high risk of being used in doses that are too high. Avoid using these products. Special precautions and warnings. Children, caffeine is possibly safe when taken appropriately by mouth or intravenously, by 4, as well as when used in amounts commonly found in foods and beverages. Pregnancy and breastfeeding. Caffeine is possibly safe in pregnant or breastfeeding women when used daily amounts of less than 200 milligrams. This is about the amount in 1-2 cups of coffee. Consuming larger amounts during pregnancy or when breastfeeding is possibly unsafe. Anxiety disorders. Caffeine might make these conditions worse. Use with care. Bleeding disorders. There is concern that caffeine might aggravate bleeding disorders. Use caffeine with care if you have a bleeding disorder. Special precautions and warnings, continued. Heart conditions. Caffeine can cause irregular heartbeats in sensitive people. Use caffeine with caution. Diabetes. Some research suggests that caffeine may affect the way the body uses sugar and might worsen diabetes. However, the effect of caffeinated beverages and supplements has not been studied. If you have diabetes, use caffeine with caution. Diarrhea. Caffeine, especially when taken in large amounts, can worsen diarrhea. Epilepsy. People with epilepsy should avoid using caffeine in high doses. Low doses of caffeine should be used cautiously. Glaucoma. Caffeine increases the pressure inside the eye. The increase occurs within 30 minutes and lasts for at least 90 minutes after drinking caffeinated beverages. Caffeine dosing. The following doses have been studied in scientific research, by mouth. For a headache or improving mental alertness, 250 mg per day. For tiredness, 150 to 600 mg. For improving athletic performance, 2 to 10 mg/kg or more has been used. However, doses in excess of 800 mg per day can result in urine levels greater than the 15 mcg per milliliter allowed by the National Collegiate Athletic Association. For weight loss, the ephedrine, caffeine combination products are commonly dosed 20 mg/200 mg 3 times per day. For a headache after epidural anesthesia, 300 mg. For preventing gallstone disease, intake of 400 mg or more of caffeine per day. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one healthcare. Please also like, share and leave a comment below.